Thank you for the introduction. And I'm George Paliouras. I hope it's okay if I continue in English, right? Sure. So I'm George Paliouras. I work at the Research Center Demokritos here in Athens. And what I will be talking about today is a new project that we started in April. And it's a fairly large collaborative project involving 9 European partners and 1 US partner. And it is about more or less what the vision that was given in the previous talk talked about. So the idea is how can we use big data, can we bring big data together, analyze it, and make it work for us regarding personalized medicine and health policies. As I said, this is a European-funded project, and it is on its 7th month at this point, so things have started happening. I don't have the time to go into deep technical detail, but I'll try to give you an overview of what we want to do. So one of the things that, one of the motivations that we have for starting this project is the fact that we think what is currently done with data, with big data, is not sufficient for the personalized medicine era. We think that we need to combine 2 very different types of data and respectively 2 very different types of big data analytics methods. The first has to do with what we usually do, which is analyzing data for very many people, for large populations. And the other is to analyze a lot of data about individuals or about small groups of people. And these need to happen in parallel, and the results need to be integrated if we are to be able to draft policies and eventually diagnose and provide solutions to health problems of individuals. So in IASIS, what we want to do is that we want to combine various different types of data, clinical, pharmacogenomics, and various other types of big data. And what we want to do is to turn that into actionable knowledge. We want to be able to give that to clinical researchers or even health policy makers and help them in making the step towards precision medicine. And in doing that, as I mentioned earlier, we are developing methods for analyzing very different types of data. We're looking at what we call unstructured data, which is usually text, but also structured data coming from databases. We also look at images, and we look at sequences coming from various types of genomic transcriptomic and other types of analysis. And this is all happening in a big data framework. In IASIS, as case studies, we're focusing on 2 different, very different diseases. One is lung cancer, and the other is Alzheimer's. And there are several motivations for choosing those diseases. The first immediate reason for choosing this is their difference. We do want to show that the methods that we are going to be developing are useful for very different cases. Another very strong motivation is that both of those diseases seem to be very much in need of precision medicine, of personalized medicine. Many of the drugs that have been out there for Alzheimer's and lung cancer only work for a very small population, and this has to do with the diversity of the patients, the very different characteristics that they have. So on the left of this slide, you can see a rough overview of how we go about it. So we have, we're looking at the bottom, you can see the various different types of data that we're looking at, and this include health records, as I mentioned earlier, genomic data, bibliography, open knowledge about the disease, open databases, public databases, and ontologies. All these need to be brought together. And they are brought together by being analyzed with the appropriate technology. So we have different analysis methods for different types of data, but then the results come together in what we call the IASIS knowledge graph. And this is a unified linked data schema for all the technology that is going to be produced by the various different analysis methods. And based on this graph and on some meta-analysis that we can do on top of it, basically in order to identify correlations between unrelated data, data sources, the end users, and end users being either clinical researchers or public health policymakers, can access this knowledge in various different, as natural as possible ways. They will be able to give questions, issue questions, and get natural language answers. And the important aspect here is that we want to be able to justify and lead back to the sources regarding any answer that is provided by the system. Another very important aspect in any of those big data, health big data projects, is the issue of privacy and access control. And many of the data will have to stay where they are produced, so we need distributed methods that respect the policies of the data source of the data providers. I'm going to give you some information about each of the pilots that we are running. The first one, as I mentioned, has to do with lung cancer. And lung cancer, as you are probably aware, is one of the most serious, dare I say, types of cancers because of its prevalence in the population, of its cost for the health system, many different reasons. At the same time, it is very interesting for us because the different lung cancer patients have very different characteristics at various levels because of their life or because of the type of the tumor, because of the reason why they got the tumor, and so on. And the IASIS project aims to discover correlations that will allow better prognosis, better estimation of the response that we get for different treatments that we do, that the doctors do. That's what we are aiming at. And this is based on largely on the genetics of the patients, but also correlating that to various different other information that we have about the patients. And this is a picture drafted from the medical doctors, the oncologists that participate in the project. And on the left, in this blue box, you see what is currently happening with a lot of interventional techniques, biopsies, and various other methods. And on the right, a lot of this is going to be substituted, hopefully, by less invasive methods that can happen more frequently based on blood samples. And this needs the support of big data analysis. I mentioned already that we're looking at early detection, prognosis, and response to treatments, and so on. In order to achieve that, we are working with electronic health records, CT images, genomic data coming primarily from liquid biopsies, that is from blood, circulating tumor in the blood. And we have these from a number of different sources, primarily from the hospital that we're working with, which is this hospital in Madrid. And this is augmented by open data, public knowledge about lung cancer, related ontologies and taxonomies, as well as many collaborations with other projects that are working on lung cancer. Although very different in nature, the approach in Alzheimer's is very similar. Alzheimer is also a very serious condition, very serious disease, and it's getting more serious as the population is aging. And it is particularly difficult for people doing research in this disease to identify treatments that will help many people. So personalized medicine is hopefully will hopefully help them to discover personalized approaches for prognosis, response to treatments, outcomes, and so on. And here, of course, genomics is less well understood, but we are basing our work mainly on medical records and lifestyle parameters of the patients. This is a sort of a scenario that again has been provided to us by the St. George's University Hospital in London, who are working with us, and to help us understand what they're looking for. And they are interested in genetic presupposition of the patients. They're looking at comorbidities, but as I said, they're also very much interested in the lifestyle and the clinical characteristics of the patients. And eventually, what they want is that they want to be able to ask questions to the system, and the system will provide them with hints that will help them in drafting new procedures for specific parts of the patient population. Here again we have some patient data that we're working with. Primarily the data will come from a very interesting network that has been built in the UK, which is the UK CRIS network, with about 2 million people with dementia, and but also this is going to be augmented by data coming from various other sources, as well as public sources that I already mentioned in the lung cancer case. But obviously in this case it will have to do with Alzheimer's. And beyond dealing with data and doing our computer science and IT work, we need to be very much aware, I hinted on that earlier, on privacy issues, and we have set up an ethics committee that is led by an external advisor to oversee all the work that we do and make sure that we do not violate any of the regulations, and we are proactively trying to even adhere to the GDPR that everybody is talking about these days. Data management issues are very important. What can be provided openly to promote research and in what form. And eventually access control, as I mentioned earlier, some data cannot leave the site where it is produced. So we need to modify our approaches to deal with this. Closing this talk, this is a map, a geographical overview of the partners that are involved in the project around Europe, plus the University of Maryland in the US. And that's it. Thank you.
Thank you very much, George.